empowering the patient, empowering the family is maybe even more of a critical component than having two specialties or multiple specialties working together to manage the limb. Ultimately, we do the job of trying to preserve the limb, but it's very much a involvement of a whole network of people. And, we do it all the time. We have constant communications with patients and their family members about the process. And I think that patients and families in general a lot of times feel lost. When they come to our clinics and they're being told they may be losing a toe, losing a foot, or losing a leg, I think a lot of times they just shut down. And they're not ingesting everything that we're telling them. I could sit here and give them all kinds of information and resources, but once they hear amputation, they're already shutting down. And you can see that when you have these conversations with these patients. So I think providing a resource where you could say, hey, you have the conversation with the patient, but say, hey, why don't you follow up our conversation by going to this resource? There's a whole host of information here. There's links to individuals who have been through this process. I think it helps ease some of the concerns and some of the burden that's now placed on the family of what are we going to do after the limb is lost or after they've gone through lots of care. How do we manage things on the other side? And I think that's the biggest challenge for patients, is trying to realize life is not over if you've suffered a toe amp, a forefoot amp, even a below-knee amputation. I always empower my patients that, hey, we're doing this to get you back to living your life and back to work. But having a centralized place for them to be able to go there on their own at home, tell family members, hey, why don't you visit this site? There's videos, there's content that'll kind of help walk you through the process, I think is an enormous gap that we have currently, and I think ultimately it will help with better patient care and more successful outcomes.